to 28. So our total confirmed cases now in Queensland is 1,121, and the number of tests that have been conducted in the last 24 hours has been 10,558. So I really want to thank everyone for going out and getting tested. And since we've had this latest cluster, we have now had 131,186 people who have come forward for testing. So I do want to do a big shout out for all of those people. But remember, it's absolutely critical that if you have any symptoms, please go and get tested. So in relation to these 4 cases, like yesterday's cases, they are known contacts of people, of existing cases linked to the Corrective Services Academy. And of course, we wish all these people well. It wouldn't be easy to get a test result saying that you're positive, and we do wish all the best to the people who have had a positive. So of course, everyone also is aware that as of 8 a.m. Monday, those restrictions of aged care visits and the number of people you can have in your home and outside gatherings without a COVID-safe plan will extend to South Burnett, Southern Downs, Toowoomba, Western Downs and local government areas. And of course that doesn't apply if you have if you're going to a restaurant or a cafe or a bar where you have COVID-safe plans in place. Now, Dr. Young will talk a little bit more about these 4 new cases that are known contacts, but I can say that 3 reside in Forest Lake and 1 in Collingwood Park. So Dr. Young will go through more details about those specific cases. But before handing over to Dr. Young, I just want to talk to Queensland about a really important issue, and that is dealing with mental health. So from tonight, we'll be launching a brand new mental health campaign, awareness campaign called Dear Mind. And it's very important during this time. Look, we've had a lot of change in our community. So it is absolutely crucial that we talk to our loved ones, our friends and our family, and just ask them, are they going okay? This pandemic is taking a toll on everyone, and everyone will be impacted on some way, whether that's not seeing friends and family as much as they used to, or with these restrictions in place, not being able to go and see your loved ones in aged care facilities or visit a close family friend who may be in hospital or a loved one. So we know that's taking a toll on everyone, and this is a great opportunity, a great time with this awareness campaign to actually stop for a moment and check on one another and make sure that everyone is going okay. And of course, if you're not, there is no problem in going and seeking help. In fact, that's what we should be encouraging people to do. If you've lost your job, of course, that's going to be having a huge impact on not only yourself, but your family and friends as well. So we want to help people as much as possible. That's why we've put funds into this awareness campaign, but also to the $46 million is also going to support a lot of organisations across Queensland to cope with any added volume of people that may be seeking help during this time. So look, I'll hand over to Dr. Young to talk more about these 4 cases, but of course remember, if you have any symptoms, please go and get tested. Please do not go to work, do the right thing. And we do expect to see some more cases over coming days because of the contacts of families and friends of the people from the clusters. So, and once again, I do want to pay a big tribute and shout out to all of our contact tracers that are doing an incredible job, the rapid response, Queensland Corrective Services and Youth Justice, and of course Queensland Health, and all of the people out there that are conducting the testing as well. It has been first rate, and I do want to pass on Queensland's thanks to all of those people who are doing an outstanding job to keep Queenslanders safe. I'll hand over to Dr. Young.
Thank you, Premier. So we have 4 new cases overnight. All 4 of those are close contacts of a known case. So we don't have unknown transmission happening in our community in Queensland today, but we have to be alert to that. We have now had over 101 days of infectious people out in our community in the last 14 days. So that means there's been those 101 opportunities for people to get infected. So we know that we will see more cases. It is critical that people, if they have any symptoms at all, don't think it's anything else because it's most likely to be COVID-19. So come forward and get tested. And thank you so much to all of those people who came forward yesterday to get tested. That's really, really important. So specifically these 4 new cases, 3 of them live in one household and they live in that household with 2 other cases that we already knew of. So it's not surprising that's occurred. And that is why it is so important that household gatherings cannot be more than 10 people. We know that at this stage of an outbreak, it's household transmission and transmission from one household to other households that is the key trigger for increased cases. We saw that very, very clearly down in Victoria. So that limit of 10 people in a household, that's all the people in that household, including the people in the household and any visitors, although of course if you normally have more than 10 people, of course those people can continue to live there, but you can't have more than 10 people if that means visitors coming in and increasing that number. That is just absolutely critical. So those are those first 3 cases. We're just tracking down where those 3 cases work and where they go to school or go to childcare. So we'll have further information on that, and there'll be contact tracing that will occur, of course, at those facilities to see whether there are further close contacts that we need to go into quarantine, and that will happen through today. Then the 4th case is a person who was in close contact with a known case but not in a household. This was at a gathering that this person was at. Now we do know they attend the Staines Memorial College. They attend that school, and that school has already alerted other students and families about the case, and indeed it's associated with a church so that people were told not to attend. There'll be more work done today. That school, of course, will go through the usual cleaning. There'll be contact tracing occurring, and until that can all be finalised, that school will be closed. So they've already started all that work, and we'll see how far that gets through today as to whether it's able to open tomorrow or not. But that school has a very good system in place, and they've already contacted all of the families. So that's our 4th case. So all 4 cases, known contacts. We're going to expect to see more cases like this where people have been known contacts. Now, because some of the confirmed cases travelled out to Toowoomba, a decision was made yesterday that we need to protect the vulnerable people who live in the Darling Downs Hospital and Health Service region. So that's people who live in Cherbourg, Goondiwindi, South Burnett, Southern Downs, Toowoomba and Western Downs. So we have brought in exactly the same restrictions for those areas as we now have in place for all of Brisbane, Logan, Ipswich, Gold Coast, so for all of that area, and Redlands, so that greater Brisbane area. So the same restrictions. So the same restrictions on aged care, on disability accommodation services, on visiting people in hospital, on the use of personal protective equipment in hospital, and most importantly of all, that limitation on gatherings to a maximum of 10 people. So that's any gathering that occurs where there isn't a COVID-safe plan. So weddings and funerals can still have 100 people as long as there is a COVID-safe plan in place and it's followed. Although, can I make one comment about funerals? I heard a very sad discussion yesterday that at funerals, people who are living in a household feel that they can't comfort each other at the graveside. Of course they can. If people are in the same household, so they're comforting each other in their own home, they can comfort each other at their graveside. Funerals are such a difficult place. So yes, of course, if you live in the same household, you must comfort each other. There is no additional risk doing that because you're already in the same household. Different households, no, you can't, because then there is a real risk you'll spread it. And the work that the funeral industry has been doing to make funerals COVID safe has been exceptional. Then a few other things I would like to raise. So over the last few days I've been saying to people, this is the time to get out those flat surgical masks that you can now buy anywhere. You know, those masks? Or if you've made masks with 3 layers of thickness, they're effective as well. Not quite as effective, but they're pretty good. It's really time to start using them. If you can't socially distance when you go to the shopping centre, use a mask. Try to always socially distance. That is far more effective, but if you can't do it, use a mask. If you're in a taxi or a ride share or in public transport, that's the time to wear a mask, because you can imagine we've all got our windows closed. It's a bit cold at the moment for Queensland, so we're sitting in a confined space. We're in a taxi or a ride share or our own car. If there's anyone who's not part of the household who's in that car, really think about using a mask to protect yourself and to protect others, because you can't socially distance in a car, for instance. And public transport, if you can't socially distance there, wear a mask. And then also, I know a lot of people are still very effectively working from home, and that is excellent. Continue doing that. If you can effectively work from home, then do that. If you can't, there is nothing to stop you going to work. Go to work, right? We've all got our COVID safe plans in our workplace. But if you are working from home and it's working for you and your manager and your colleagues, then work from home. Maybe not every day, but intermittently, it's a good idea just to lower the amount of engagement out there. This is not because I think there's any increased risk. It's just I'm trying to manage the risk going forward, because we know that the cases we have today are a result of what was happening 2 weeks ago. So really, this is just being ultra cautious and thinking about everything we can do so we can maintain our society as much as possible. It's really important that we maintain our workplaces, our schools, our hotels, our restaurants, our clubs, our cafes. We've got excellent COVID safe plans. If we stick to them all and use them, we can continue going forward while we manage this current cluster. This cluster is growing, 4 cases today, 4 cases yesterday, but we can keep that all under control and not have to impact on the rest of our lives and what we're doing, as long as we adhere to just a few of those straightforward requirements that are out there. Thank you.
Dr. Young, have you identified the case linking the detention centre with the academy?
We have identified one link between the Brisbane Youth Detention Centre and the academy. So there was one of the cases who was a close contact of a worker at the Brisbane Youth Detention Centre who is a friend of one of the partners of one of the workers at the academy. So you can see the tenuous nature here. So that is one of the cases. So we have identified that link, and we believe the worker at the academy actually contracted the infection from their wife, who is the friend of a partner of one of the workers at the Brisbane Youth Detention Centre. But that's one case. We haven't worked out the other cases at the academy where they've contracted their infection, but we do know, just with that one case alone, there are a lot of links between the people who work at the Brisbane Youth Detention Centre and the people who've been attending the academy, as one would expect. So there's a lot of social social links, there's a lot of professional links. So we imagine that that's where all of this has happened, although we haven't confirmed it for all of the cases.
You're happy now to sort of deem that as one cluster between the two facilities?
I think it probably is one cluster, but I don't have all the direct links. Of course, we're doing all that genome sequencing, and that'll give us a better idea, but I suspect that we'll see that they're all tightly clustered around one genome with very few changes in it. So it won't give us absolute definitive proof. But as we unravel all of these contacts, which our contact tracers are doing, they're very effective, they're very experienced, we'll find more of these links.
That Collingwood Park case, you mentioned it's a close contact, but is that the first example of it being someone who's not either a worker at either of those facilities and a household member of one of those people?
Sort of, but you've got to remember that some of those others, as I just explained, were social contacts. They weren't work-related contacts, they happened outside the work setting. So we do have community transmission happening here, but we know where it's happening and how it's happening.
Am I right in saying all these previous cases have either been people that worked at the detention centre or academy or someone who lived in their house? And this maybe
No, we've had people who didn't live in people's houses. So as I say, we're getting up there with these numbers, so you'd expect that you've got people who are interacting with other people.
And Dr. Young, just to confirm, this current cluster we're talking about now, that is also directly linked to those women who went to Melbourne and then came back. Is that correct? Or?
Well, we haven't done all of those linkages. As I said, we've found one case that is linked to the Brisbane Youth Detention Centre, and we believe that the balance of probabilities that the Brisbane Youth Detention Centre is linked to the Melbourne Logan cluster, but we don't have definitive proof and we don't have the epidemiological link. But given that we don't have other cases out there, and we're doing so much testing, as you've heard, 10,000 cases day after day, up to 20,000 cases. So I think if we'd had another cluster out there, we would have found it. But it's still possible. So until we've done all of the genome sequencing of all of these current cases, it's difficult to say exactly. That's the contact tracing that's happening. So this was an older boy who mightn't necessarily have had contact with everyone. If you think earlier on we had a school cleaner who I was very worried about because they'd been through the entire school. So we had to contact trace everyone because we didn't know exactly where she'd been and who she'd been into contact with and if there were any fomites that she'd coughed and left virus. Whereas this is a very, very different situation. This is one student, and if we can work through when that student was infectious and at the school and where they went in the school and who they had contact with, we might need to close down the entire school. So that work is all happening today.
And what about the Big Tree Pocket Early Childhood Centre? I saw that a letter went home to the families yesterday. They have to self-isolate. Can you take us through that?
Yeah, so we'll just have to work through again. That's only recently, we've only recently become aware of that, so we'll just have to work through. Again, childcare centres, some childcare centres have their children in totally separate rooms and there's no linkages, there's no shared area. Others have everyone sharing. So we just have to work through all of that and see what it means.
That's connected to one of the four.
Yes,
Okay, so that's a
believe so.
child that's been infected or a staff member?
A child.
Imagine a figure of about 101 days since. Can you explain?
Yes, that's very complicated. It is, so if someone is out in the community for 5 days before they get tested and they self-isolate, that's 5 days potentially that they could have infected other people. So we just did a piece of work on Friday and added up all of the days in the last 14, because that's the incubation period, that people, known cases, had been out in the community while infectious. So there were 101 as of Friday night. That will have increased over the Saturday, Sunday with these 8 additional cases. But you can imagine my concern. 101 is a lot of opportunities. We had far fewer days when someone was out in the community infectious with that Melbourne Logan cluster of 5 people.
We're not going back 100 days.
No, I'm sorry, I didn't explain that very well. It's the last 14 days that we've had 101 days worth of opportunity for people to get infected.
Dr. Young, just in regards to masks, obviously, just in regards to masks, obviously you're stepping up the notch there of how important it is to wear it and when to wear it. Do you see a point, gradual increase in numbers and curve continue, but do you see a point where masks become mandatory?
I do see a point, but not for a while. I think there are some settings, there could be a point at which we mandate masks, but not for the general community, not at this stage, no.
Are you happy with testing numbers? We talked about over 10,000 in the last day. Is that enough at this stage?
Of course, I'll always want more testing, but I only want people who are sick to come forward and get tested. We're finding that all of these people that we're testing who are positive, they've got symptoms. So it's really, really important if you've got any symptom at all that you come forward and get tested. Now, I don't have this data for Queensland, but I do have it for nationally. Nationally, some work's been done to look at what percentage of people who have fever and cough are coming forward to get tested, and it's about 50%. So I don't know what it is here in Queensland, but it could also be similar or it could be much, much better. It actually doesn't matter. The answer is that if you've got any symptoms or fever or history of fever, it's really important that you're the person who needs to get tested. We don't need people who are well to get tested unless they're close contacts, and we'll be asking you to get tested. You don't need to come forward. This is about people out in the general community. Any symptoms, just come forward and get tested. And it's if you've got symptoms that we really need you tested.
Do you think potentially we're looking at further restrictions in the southeast, or are you confident that this cluster is fairly contained?
I think I'm not confident that the cluster is completely contained, which is why we need to have the restrictions that have been put in place. But I am confident that we have really, really good COVID-safe plans. And as long as people comply with them, and it's not easy, I recognise how difficult and unnatural it is complying with some of these COVID-safe plans. But if people comply with them and they minimise those gatherings down to 10 people where you don't have those COVID-safe plans, then that could be enough to get us out of this current cluster. That's really important.
Is there any thought being given towards movement restrictions?
No, not at the moment. Again, because we have got really good COVID-safe plans. Now, of course, if you're sick, don't go moving. You've got to be at home. If you're sick, don't go on that holiday or that trip. Just stay at home. But I think people have heard this, and I can see just in the information that we're getting now, the people we're testing now who are positive have been in the community for a much shorter period of time than the people at the start of this new outbreak, which makes sense. So at the start of this new outbreak, people weren't thinking, I might have COVID, because we were getting fairly comfortable with where we are. Now people are thinking it and are coming forward and getting tested more quickly, which is good.
Positive. Were they coming forward conscious of their connection to the existing outbreak, or was it purely because they had symptoms and they just wanted to get tested?
Well, these more recent ones today are because they're close contacts and they're getting tested. And they were in quarantine, yes. Yes, yes. But not in quarantine during the period when they were infectious, because that's why I was saying earlier, people are getting tested earlier, but these people went into quarantine as soon as they were identified.
I guess part of routine testing then while they were in quarantine.
No, they were unwell. Yeah, but they're mildly unwell. So that's the other message. We've got a lot of people out of these 2 new clusters with very, very mild symptoms. And I can understand why people didn't come forward to get tested. They were really mild symptoms. So that's just the message. Doesn't matter how mild the symptom is, please just get tested.
Yesterday it was mentioned that more broad testing is going to be done at the Arthur facility.
Yes.
Prisoners and staff.
Yep.
Are there any of those results back?
No, they aren't, but we're out there testing large numbers of prisoners, remembering that prison, correctional centre, means that you can manage that quarantine. They're there, we know where they are, so they're in quarantine, and now we can just methodically go through and test the people who need to be tested.
And Dr. Young, there have been concerns that a lot of people have been seeing cafes or schools put things on social media, and then it's been 12 or up to 24 hours until those locations have been posted on the Queensland Health website. Why is there such a lag?
It's just us getting hold of those people and putting that information. We really want to talk to them before we go and post it, and we are in contact with them, so it's just a timing delay.
Is it concerning? 24 hours, is that too long for people to find out?
It's not, because we're contacting the people that actually matter. We're contacting the close contacts. So the reason we're putting it up on our website is for the casual contacts. And can I say really that anyone who lives in that southeast corner should think of themselves as a casual contact. They might have been somewhere where one of our cases have been. So as long as everyone thinks, is that symptom a real symptom? Or it could be, I need to go and get tested. Then that's the important message that needs to be out there. We're contacting the close contacts. We know who they are. And thank you to everyone who documents their names. It's working really well. We're getting those contact details from people. That's important. So it's those casual contacts that we don't necessarily know about, and they're the ones that we then go and post when we're able to work through all that. But truly today in southeast Queensland, any symptom at all, don't wait to be told you might have been somewhere of concern. Don't wait for a phone call to tell you you're a close contact. Just immediately come and get tested.
And how concerned are you about Cherbourg?
I'm not particularly concerned about Cherbourg, other than it has a lot of vulnerable people who live there. So there is absolutely no evidence at all that any of our infectious cases, confirmed cases, have gone to Cherbourg while infectious. I'm very, very convinced of that. But we know that Cherbourg, if the virus was to get into there, would be high risk. So it's part of that area that I've now said needs to limit gatherings and needs to increase the restrictions for vulnerable people.
And why do those new spots head all the way out to Gundawindi? Has someone been there, or why?
Yep, so we have had someone go to Toowoomba, to a couple of venues there, and we know that the people out at Gundawindi and all of those areas use Toowoomba as their base. So it's very, very important. And this is just sending a message that this is a time to be very careful. And if we can manage all this now, we won't have to put further restrictions.
Yeah, sure. Oh, I've only heard some reports, but I'm quite sure the police will investigate that. But can I just say to everyone, you have to social distance. If you're not social distancing, you're not only just putting your lives at risk, but your friends and family. So I've just heard some reports about that, Shannon. I'm happy to follow that up with the police. Yep. Look, I just encourage everyone should be socially distancing. You've heard Dr. Young. Now is the time to make sure we are doing all of the right things, because we know that there is some virus in our community. So that is why everyone now has a responsibility for themselves, but also their friends and family. And we don't want to put people at risk.
Premier, will you support or consider supporting a national hotspot definition? And what do you think about the Danish traffic light system being?
Well, we haven't got any evidence of that yet, so I'm happy to have a look at it.
The Prime Minister said that he would like to see a national.
Yeah, but he hasn't put any proposal to us yet.
So you wait and see the proposal.
I'll have a look at the proposal, but let me make it very clear. We will do everything we can to protect Queenslanders and to continue to ensure that Queenslanders are safe. Now, our closure of our borders have been one of the most effective measures we have in combating this virus. And we know that people wanted to open our borders earlier, and we would have seen a situation that's happening in Victoria happening in Queensland if that had happened. And I'm not going to put Queenslanders at risk.
Premier, Clive Palmer has threatened to take you down at the election. No doubt you're very fearful of this.
Clive Palmer, like speaking about borders, Clive Palmer and Scott Morrison put in a joint action to open up Queensland's borders. Clive Palmer fought the federal court case against Western Australia. The federal government put in their submission. They may have withdrawn from the action, but their submission was still part of the evidence. And the federal court found that the states have a right, based on health advice, to keep their borders closed to protect their community. So, you know, Clive Palmer, he's got a lot of money. He can do what he likes with that money. And obviously he's teaming up with the LNP.
Not overly concerned then?
No, not really. The less said about Clive Palmer, the better, I think.
With the AFL, sorry, one more chance.
Yes.
Do you have any
Joel?
idea of when you might hear back from the AFL?
No, the only thing I heard, Joel, was that last week I think some of the other states were presenting to the AFL, and we look forward to waiting to see the outcome of how those other presentations went and how our presentation went.
I think this current,
So fingers crossed. Keep our fingers crossed there.
could this current cluster impact our chances of getting it, do you think?
Claire, look, I don't think so, because I think what we've shown very clearly is how our rapid response has been deployed. It's very effective, and it's all known contacts at the moment, so that's good news. And as I said, you know, we've got all of our agencies working there, and you know, all of the sport is continuing. Just on community sport, can I say too, it is also very important for people to make sure that they are socially distancing at community sport events as well. We had some concerns about that netball gathering. I had people contact me personally as well about the lack of social distancing that was happening at the netball, and hopefully the netball associations will re-emphasise their COVID safe plans to everyone as well. We've all got a part to play here. That's right. Look, I'd have to take the health advice on that. Is that right, Dr. Young? Yeah.
So,
Yeah.
yeah, it's difficult. I assume you're talking about one of our hotels, not a
We might
home.
get some more information and get back.
Yeah. Look, we now have 24 hotels with people in quarantine. This is really, really, really difficult. These are people wanting to come up in the main part from Victoria and New South Wales for various reasons. And this is possibly not the best time for people to be relocating their lives. I know it's really hard for them in other states, but people need to think through what they're doing. This is really hard. Now, where we can, we are trying to give those fresh air breaks, but there's a lot of people in those hotels. We're now approaching 5,000. It's really difficult. So they're being managed by police and health jointly. So here in Queensland, we have health staff involved with every single one of our hotels. That's not the case in other states. But we made a decision that we needed health staff, and we needed to treat these as step-down facilities almost from our healthcare service to provide support. And so we are providing support to all these people, and this is really difficult. It's 14 days that they need to remain in quarantine, because if they come out and they have the infection, we can see that one case can lead to multiple clusters. Just one case in Victoria led to thousands of cases. So we can't risk that. And every day every day or so we are seeing a positive case in our hotels, and each one that we're seeing in our hotels is potentially hundreds if not thousands of cases we won't see in our community in Queensland. So I do feel for them. This is really difficult for them. I can understand that, to spend 14 days in those rooms, but these are good hotels. They are providing food. I understand they have good internet, they're providing things that they can do, and I just thank those people very, very much for doing that 14 days in quarantine.
The mask and stay at home advice, is that an escalation of advice, or is it just sort of...
No, I'm just saying, I've been saying now for several days that masks are a good thing. They're an additional protective factor. They should only be used when you can't do all the other things. They're not as good as social distancing, but if you can't socially distance and you're indoors or in a confined space, then a mask is a good thing. So that's for masks. So it's really more about the fact that due to some absolutely amazing work that was done by another part of government to set up local manufacture here in Brisbane, we've got the masks. So we've done all that hard work. Why wouldn't we start using them? We couldn't do it back in March. If you remember, in March, the majority of the world's masks were being produced in Wuhan, and we couldn't get them. So for me to go out and suggest to people they wear masks back in March would have been impossible. Whereas now we've got them, so we should use them. They're just sensible. Then the staying at home for workers, that's just a continuation. I'm just continuing to encourage people, if you can work from home, and I know from some people that they've actually been far, far more productive. They've found it very effective for them. And I think it's one of the things we'll all learn out of this pandemic. If you can work from home, maybe not every day, but you can imagine if everyone has one day a week that they work from home that really works for them, that means you've decreased the amount of people out and about by 20%. So it just will help. It's not, I'm definitely not mandating it. We're not in the March situation. We're totally, totally different. But I'm just saying it's not a bad idea if people do that jointly with their employer. And their employer might like it as well, because can I say that where I'm seeing most of this transmission happening, it's in the tea room. It's in the social gatherings at work. It's not in the workspace. So there are other ways, of course, that the employer could work that through as well.
And Dr. Young, just finally, we've been talking about, taking care of ourselves and this being a really demanding time for us all. How are you going?
Oh, thank you. I'm going very, very well, thank you. I've got the most fantastic support group. I'm so glad I'm here in Queensland. There are other agencies, as I just mentioned about the masks, who just take things and run with them. They do them. And then the work that police have done, and then the support from the government here in Queensland is exceptional, and it works so well. We know in Queensland how to deal with crises, and we've just got this perfect system, and it just rolls out. So it works really, really well. So, but thank you for asking me. I'm going very
Any
well.
tips?
Thank you.
You just seem to be nailing it day after day.
Oh, I don't know about that. The tips are to find the best support team you possibly can, but you need to organise that team 10 years in advance.
Thank you. Thanks, everyone. Thank you. We'll head up.